In the almost 5 years that I've had the Accuro neuraxial guidance device in my personal practice, I've definitely had my fair share of anatomically challenged and morbidly obese patients, many of whom have been in the realm of obstetric anesthesia. One patient in particular that I will probably never forget was referred to me by one of my nurse midwife colleagues, who referred to her as a very special patient. She was in her mid-30s. She was pregnant with her 9th child. Her BMI was probably in the mid-60s, and she weighed well over 350 pounds. With her first delivery, she was in a university setting, and not surprisingly, the anesthesia team there could not, even after many attempts and many providers, get a successful epidural placed. She had a very rocky course of labor, ultimately required an urgent C-section. And again, because of her obese size, the anesthesia team was not able to get a functional spinal for the surgery, so she had to have a crash induction. Ultimately, her experience and the experience of her husband was extremely traumatic, and they vowed never again to deliver in a hospital setting. She had babies 2 through 7 at home with a midwife and a doula, and actually did very well with that, but always felt that the pain and the suffering, and yet the fear of not being a candidate for any type of relief, placed her in a situation where she had nowhere to go but try and deliver at home. With her 8th pregnancy, she developed severe preeclampsia and unfortunately did need to be in the hospital setting. Again, fearful that any attempts at an epidural would just be for naught, she refused an epidural, had a very difficult course, did deliver vaginally, but suffered a 4th degree laceration. So now with her 9th pregnancy and her preeclampsia being quite significant, I was asked to meet with her and discuss the possibility of using the Accuro device to guide me in placing an epidural for her. It was surprising to me that with the Accuro in hand, I could gain some trust and confidence with her. I could certainly gain a bit more confidence in my ability to offer her a successful epidural. And I'm happy to say that when she did come in for induction of labor, I was able to give her an epidural that worked quite well on the first attempt. And she did have a very wonderful labor and delivery with a vaginal delivery. And I think ultimately for all of us, the knowledge that we took a couple who lived in fear for 15 years of having babies could close this chapter in their lives out, knowing that we heard her concerns and we were able to use a technology that could address her particular challenges. So I'm very proud of that, and I certainly will take that with me throughout the rest of my career.